This demonstration will be showing how to administer medication via burette infusion. I have my scenario and my drug chart and my IV chart. I just need to make sure I've got the right scenario for the right person. So I've got Jessica Fong, she's needing IV antibiotics, and this is Jessica Fong's IV order and Jessica Fong's drug chart as well. So now I'll get ready, I'll identify the drug, and I'm going to administer ceftriaxone, so I'll get my equipment. Once again, I will clean down my trolley, make sure it's not got any contamination on it, like that. And my equipment will be, I've got a sharps container, I've got my gloves, I've got my hand wash, I've got my charts. I also have my 10ml syringe, a needle, to draw up with, some water to dilute the drug with, some swabs, and I need the drug, which will be ceftriaxone. The other thing I need is a label, a pen. Right, so now I'm going to look up my drug. I know I need to administer ceftriaxone, I need to know what it is, so I'll look it up in the MIMS or the drug book, and it will tell me that it's an antibiotic. The dose seems appropriate and I can administer by IV method. I'm going to look up my Australian Injectables Handbook and check how I can administer this. Now apparently Jessica has a bit of a reaction to a fast injection of a drug through the IV cannula, so I'm going to dilute it and put it into the burette so it runs a bit slower. Now I've got ceftriaxone, and for IV use it says reconstitute 0.5 grams or 1 gram vials with 5 ml and 10 ml of water respectively, and I can give it as an IV infusion, dilute to desired volume with compatible infusion solution, and administer over at least 30 minutes. Compatible infusion solution would be, here we go, sodium chloride 0.9%, 5% glucose, and I'll just check that I actually have that as my IV fluid. Now I will prepare the drug. Nurse, can you please check this with me, please? Sure. I have to administer ceftriaxone for Jessica Fong, IV, 1 gram, it's twice a day, the doctor signed it. I have ceftriaxone, 1 gram, it expires in 2020.
I've just noticed that the doctor hasn't put a date on that. Can we just rectify that before we administer?
Sure, we'll do that. No worries.
Yeah.
Water for injection 10 ml, January 2015. Okay, I'll get that fixed. Right. So I'll draw up the water first. It said 10 ml of water for injection. We just want to make sure we dissolve and dilute the drug down. Now as this is going into a burette, the air bubbles do not matter as much because there's air in the burette. This needle has to pierce through the top of the rubber stopper of the drug, so I need a sharp needle. I will swab the top of the drug, wait for 30 seconds. Later, I will inject some fluid into the vial. It's not going to fit 10 ml, so I'll just put a couple of mils in and then I will shake to dissolve. Drugs should dissolve to completely clear. They might be tinged yellow. The information books such as MIMS and the AIDH will tell you if they are a little bit discoloured when they're fully dissolved. Okay. If I was to lose drug, as in spill it, I would start again. A drip is not going to make much difference, but if I was to lose a lot, it would. So I've made sure I've got all of that. And to recap, I need to once again scoop Now I'd previously done my calculation and I knew that I had to administer the whole 1 gram, so that would be 1,000 milligrams over 1,000, and I've got 10 mils of water, so I need 10 mils. Nurse, can you check this with me, please?
Sure.
So once again, I've got the ceftriaxone 1 gram, ceftriaxone, and I've completely drawn it up, and it's in 10 mils. There's bubbles, but it's going into a burette.
Sure.
Now I've also written up a label that will be put onto the burette to let people know that there is a drug in it. It's got a name, you are, date of birth, ceftriaxone 1 gram, the date I've prepared it, I've signed it. Could you please sign it?
Sure.
Thank you. That goes with me. All right. Nurse, can you come to the patient's bedside with me, please?
No problem. What bed number?
Bed number 12. Knock, knock. Washing my hands as I enter the room. Hi, Jessica. I'm Heather. I'm your nurse today. I'm here to give you some antibiotics because you've got an infection. The one that the doctor's ordered today is ceftriaxone. It's got the side effects of nausea, vomiting and diarrhoea. They're just a possibility. Are you okay if I administer the drug still?
Yes, please.
Can I please just check your ID band?
Sure.
With the nurse, Jessica Fong, date of birth 11th of the 1st, 55. You are 233912. Jessica, are you allergic to anything?
No, not to any drugs.
Okay. Before I give you the drug, I've just got to make sure that your IV fluid is correct. So I'll go through the 7 rights. I've just checked her ID band, Jessica Fong, 11th of the 1st, 55, 233912, no allergies. And I'll run through name, IV order, flask number, 0.9% sodium chloride, 12 hourly, 1,000 mils, it's signed. I know this is the current flask because it's been commenced but it hasn't been finished or signed off finished. So I've got normal saline, 0.9% sodium chloride, 1,000 mils. It's in date, 2016. It doesn't look contaminated. If I go down to the pump, according to my calculations, it should be running at 83 mils per hour, and it's not. It's running at 42 mils per hour. So I need to report that and change that. But in the meantime, I will administer this drug, so it will be running at a different rate for the time being anyway. Okay. Are you okay still for me to go ahead with that, Jessica?
Yeah, no problem.
All right. Because I'm putting a concentrated drug into the burette, I need to put more fluid into the burette first so that the drug becomes dilute. It said fill to a desired volume. 50 to 100 mils is desirable. Okay, so I've put, what's got 70 mils in it so far. Now, I'm just going to stop for a minute there and check your IV cannula, Jessica, whilst I'm just in between things. I just want to make sure this looks okay before I put the drug into the burette. Have you got any pain?
No.
There's no redness, no swelling, no exudate, and it seems to be running fine. Thank you for that. Okay, so I've put 70 mils into the burette. I've turned the roller clamp off. The injection port on the burette is this one here. This is the air vent. This does not have a cap, so it sits exposed. So I will swab it with an alcohol swab and leave it for 30 seconds to dry. You do not need a needle to access this port, so you just gently push the syringe down, give it a little twist, and inject the medication into the burette. Now that there is a drug in there, I will put my sticky label on to alert others to it. I note that I've got approximately 80 mils of fluid in the burette. I'll just hang it a little bit higher. So it said I had to give it over at least 30 minutes. I'm going to give it over an hour. So that's 80 mils over 1 hour, that's 80 mils per hour. So then I would say I need to change it to 80 mils per hour, and I would change the rate. Now, Jessica, if you have any unusual feelings whilst you're having this drug, please ring the bell. I will be back in 10 minutes to check on you. I just need to clean up and sign my chart. Oops. So I would be signing the date and the time, and double signature, mine and my nurse's. Yes. Now I'll clean up and I will be back. Thank you.